Intra-articular injections are often performed. You need to ascertain need for them. No joint injection is just due. Oh, it's been 6 months, he's due. Why? Is he lame? Is he sore? Is he positive deflections? Is he functioning badly? If there's an indication that's clearly there, flexion responses, lack of performance, new radiographic change, response to intra-articular anesthesia, yeah, then he's due, okay? But just because it's been 3 months or 6 months or a year, oh, we haven't done his socks in a year, let's do them. Does he need it? For the Moment was a great, I'll cry. I don't like the horses I work on, you can tell. For the Moment was a jumper who was Horse of the Year 3 times. Went to 2 Olympic Games. Never got his hocks injected until he was 18 years old. Okay? Went to his last Olympic Games when he was 18. Great horse. Anyway, point being that have a reason, have an indication for why you do these things. Not just because you think it's the thing to do, or your trainer said you have to. I mean, you know, they may be right, okay? And that's the thing, investigate it, I guess is what I'm getting at. An attention to physical comfort is important, and joint injection definitely has a role in the performance horse. Intra-articular injections, as I said, high-level athletes often have subtle joint pain. It can affect performance. For example, this horse right here, it would start in a combination on the left side, and by the time it got to the 3rd element of a triple combination, it was almost jumping the standard because the right side of its body hurt. And so it was pushing off from the left side, it was favoring the right side, it would drift right, and once we injected his hocks, it jumped straight. So some of these horses need to have some nerve blocks done to try to evaluate exactly where the problem is. Intra-articular injections is a variety of corticosteroids that can be used. Sodium hyaluronate, which is acid, there's your intra-articular adequine. IRAP, which is interleukin receptor antagonist protein, which is an anti-inflammatory substance made from the horse's own blood. Platelet-rich plasma is another product that's made from the horse's own blood, and this is a new commercial product called Prostride that's a platelet-rich plasma. I call it platelet-rich plasma on steroids because it's augmented. And actually, you do not use IRAP and PRP together. They would nullify one another. Okay, so you don't use them together. You use maybe one this week and another one 2 weeks from now, and not together. Corticosteroids, there's a variety. This is more for veterinarians. Trust me, there's a variety of corticosteroids that can be used. I prefer not to use particularly long-acting steroids such as methylprednisolone, Depo-Medrol. For one, drug testing problems, number one. Number two, some of these may have some deleterious effect on the joints if they're used repeatedly over time. As I said, IRAP's made from their own blood. The way it works is it blocks the inflammatory cascade with a natural substance. And IRAP is full of all kinds of what are called cytokines, as you see in the second entry there. Cytokines are cellularly active substances that cause reactions within the body and stimulate or block enzyme actions. And this particular product is effective in reducing chronic inflammation, and it lacks the negative effects of repeated corticosteroid use. So it's very useful. This just shows one of the old syringes for how we prepared it. The blood must be pooled, mixed, and then incubated for 24 hours, or, well, 20 hours, and then can be reintroduced to the horse, yes.
What about gene therapy for the interleukin?
Well, IRAP is basically a byproduct of gene therapy research, and it's basically activating certain cellular responses and genes that block or produce inflammatory elements.
But when you you say it's natural, so are they like pulling the inhibitors of like the interleukin genes out and then re-injecting them?
No.
No. Okay.
Let me back up. What it's doing is depicted right there. There are receptor sites biochemically on the cell for substances that stimulate the inflammatory cascade. Interleukin-1 is a substance that incites the inflammatory response. This is a receptor site. That's IRAP. It's an antagonistic protein that attaches to the receptor site that blocks these. These are all determined by gene activity. Okay? ProStride, real quick. We're almost done, guys. This is a new product that I think is really exciting. I really like this product. And I don't work for the company, okay? But made by Owl Medical. It takes advantage of some IRAP activity. It has about 5.8 times as much IRAP activity as does regular blood. But it also takes advantage of platelet activity. Platelets are thrombocytes. They are the little fellows in the blood that help form a blood clot. And they are full of cytokines and substances that make things work, that stimulate healing and repair. Okay? And it's useful as an anti-inflammatory for intra-articular injection, but we also are using it for injection of tendon and ligamentous lesions where there needs to be repair. I was going to just mention homeopathics. They're not quite as popular now as they were a few years ago. I mean, people still use plenty of homeopathics systemically, but there were some, quote, leading edge veterinarians that were trying a lot of homeopathic medications intra-articularly. I frankly don't think they work. And number two, I don't think there's any proof of efficacy intra-articularly. And if a horse had a bad reaction, there is no standard of practice that would be in their legal defense, and I don't recommend the use of them. Also, there was a time where some people were trying to use some intra-articular Tildren. Tildren in direct contact with chondrocytes is toxic, and it kills cartilage cells. So don't let your horse have intra-articular Tildren injections. The message hasn't gotten totally out there. Intra-articular injections can be helped with the use of ultrasound. For example, if you have a joint that you're not really familiar with doing a lot, injecting a lot, such as a shoulder or maybe a stifle or an elbow, for example, the use of ultrasound to see the space and put the needle in is really very, very helpful. Tendon and ligament injuries are encountered almost as frequently as joint issues. Stabilization, cooling, anti-inflammatory therapy, and rest is really what you do with tendon and ligament injuries. Now, we may help them with other things. Counter-irritant therapy, blistering, pretty much has been demonstrated not to be that effective for these kinds of injuries. I'm talking about like a bowed tendon or a badly strained suspensory. Various regenerative medicine, medical therapies can be very helpful. The regenerative therapies basically take advantage of what Mother Nature is going to do. They just help organize it a little better, and the quality of the heel is improved. The reduction in layup time, convalescent time is minimal, but you get a better heel if it's managed well. So typically we cool these out, get the initial inflammation out for the first week or so. Usually try to get back at them pretty soon though, 5 to 7 days after injury. Use a combination of maybe IRAP or ProStride, for example, for minor injuries. A-Cell, which is an extracellular matrix product, was used quite a lot back 10, 15 years ago It's still a good product. It just needs very careful management because the horse can react to it in terms of swelling and inflammation. And then mesenchymal origin stem cells for more severe injuries is useful. There's still no real concrete information that one of these therapies is definitely better than the other. The thing that is the goal is to put some sort of cellularly active substance in there that has growth factors in it that stimulates a healing response. And reducing the inflammation initially, reducing swelling, and so forth is going to augment healing.